How's it going, modern manual therapy viewers? Based upon a recent tendinopathy updates article that I post, people have had some questions about how am I applying this to upper quarter issues, because the article was for non-insertional Achilles tendinopathy. So I've done this on three recent cases. One, a medial, chronic medial epicondylalgia, another one, a chronic lateral epicondylalgia, and another one, a chronic rotator cuff tendinopathy. So to start with, the rotator cuff tendinopathy is mostly supraspinatus. They had pain with elevation, and after restoring their range, they mostly had some weakness. So based upon doing a 70% MVC, or max voluntary contraction, in a lengthened position, I had them do almost like a sleeper stretch and resist distally and push upward and outward, almost trying to like they're trying to abduct and externally rotate, or like trying to throw a ball, and hold this for 45 to 60 seconds, 2 to 3 reps, 2 to 3 times a day to maximize that time under tension. If it was painful, you could always modulate, maybe not so much a lengthened position, maybe not like this, but more like this, and also do those resisted beats to decrease cortical inhibition, or essentially modulate pain. For the medial epicondylalgia, I had them warm up with some ulnar nerve tensioners. This is actually gets median and ulnar nerve, this prayer stretch, for about 30 seconds. Then I have them resist mostly these two fingers in the elbow lengthened position and act like mentally they're going to go into wrist and finger flexion and resist that. Again, 45 to 60 seconds, 2 to 3 reps, 2 to 3 times a day. For the lateral epicondylalgia, I had them do this, radial nerve tensioners for about 30 seconds to modulate those common extensor pain. From wrist flex position, isometrically resist extension, 45 to 60 seconds, 2 to 3 reps, 2 to 3 times a day. So I've had some success with this, since the majority of tendinopathy strategies were to put it in some sort of isometric, concentric, or eccentric strategy, isometric being the number one strategy. Why not apply this to all tendinopathies? I've even done it with certain spinal conditions, but the isometric just helps modulate pain. Whereas previously I would just do maybe a simple 2 to 3 second isometric and then give up if that didn't modulate it. Now I'm trying to have people hold a light isometric, not necessarily 70% MVC, but maybe 20 to 30% MVC for 1 to 2 minutes, and often that helps modulate pain as well. So let me know how these sustained isometric in lengthening position strategies go at 70% MVC for your chronic tendinopathies, and I'll leave a comment below if they've been as helpful for you as they have been for me recently.